Welcome to the Fundamentals of Ultrasound Physics lecture series, brought to you by the Honors Ultrasound Group of The Ohio State University of Medicine. The lecture for today is on image artifacts as seen in clinical ultrasound. What is an artifact? An artifact is a false image in which echoes without anatomic correlate are observed. They do not have one-to-one correspondence with regards to location, interface, and intensity. Artifacts could be due to many things. It could be technological limitation of the system, operator error, or violation of assumptions. Artifacts could lead to misdiagnosis and overcalls. What we want to do in this lecture is to describe in detail the origins of artifacts and discuss the knowledge that is used to fix them. Let's go through some of the assumptions of ultrasound scanning. Number one, we assume that beam dimensions are infinitesimal. That is, the x, y, and z directions can be resolved down to very minute dimensions. 2, ultrasound image only comes from the transmit line of sight only. 3, speed of sound is constant. 4, the amplitude of the echo is determined solely by the reflective and intrinsic property of the reflector and nothing else. Finally, that all detected echoes originate from the main beam. As you know, a lot of these are untrue. Recall in the transducers lecture that beam dimension in the axial, which is parallel to beam direction, and the perpendicular direction or lateral resolution can affect resolution of the ultrasound image in this two-dimensional beam. There is a out-of-image dimension called slice thickness, which is perpendicular to the image plane, which can also affect the ultrasound resolution. The further you are from the transducer surface, and especially beyond the focal zone, you can see that the thickness of this z-plane or slice thickness direction is significant. This partial volume effect, which you see also in CT scanning, can creep up to the two-dimensional image that we discussed in the previous slide and thus affect the resolution by introducing artifacts that are not real. The next assumption that we're going to discuss is line of sight transmission. When a transmitter, such as this transducer, emits the ultrasound beams towards the reflectors of interest, you expect that the echoes return along the same beam direction as follows. However, in clinical and actual cases, this is not always true. We'll discuss in the next couple slides of this lecture that a lot of times images come back from outside the line of sight. The next assumption that is often assumed during ultrasound scanning is that the speed of sound, in this case of ultrasound, is constant. That is very far from the truth. You learn that in soft tissue, the sound of velocity is 1540 meters per second. However, you probably remember that in fat is slightly slower. The velocity is 1450 meters per second. And in fluid, which appears anechoic in ultrasound, the velocity is about 1500 meters per second. The differences in the speed in the different media will cause refraction of the ultrasound beam, which will, by virtue of the bending of the beam, cause the images to be located in places that you did not expect. Furthermore, with regards to this specific assumption of the constant sound speed, we will know that refraction is described by Snell's law, which we covered back in the earlier lectures. And specifically, refraction leads to three groups of errors, or artifacts. The first one is misregistration. The second one is edge shadowing, otherwise known as defocusing of the ultrasound beam. And lastly, refraction can cause ghosting, which is the doubling of the image. The next assumption that is very commonly assumed is that the echo amplitude that you see returning to the transducer upon scattering from the reflectors is solely due to the intrinsic reflectivity property of the material. However, you will learn in this lecture that that is not solely the case. A lot of times the echo amplitudes are modulated depending on the angle of inclination of the ultrasound probe relative to the structure. It is changed by frequency, as seen by acoustic scatterers, and the interface, either the material on either side of the particular interface, would have a say in terms of the difference. And then finally, the assumption that all detected echoes come from the main ultrasound beam is sometimes erroneous. Many times, even in today's ultrasound probes, where mainly arrayed probes are used, you will still see side lobes and grating lobes interacting, particularly with strong reflectors within the body that will generate lateral artifacts. In other words, what you're actually seeing in the ultrasound beam in the main part of the image will be cluttered with artifacts from adjacent structures that sometimes might not be even be from the plane of interest. And specifically, slice thickness and refraction can cause a lot of these specific image artifacts. Before we delve into the subject of ultrasound artifacts, there are a few more definitions that we need to tuck in. First one is echogenicity. And then next we're going to talk briefly about specular reflectors. And finally, we're going to talk about acoustic scattering, otherwise known as speckle. But first, let's talk about echogenicity. What is the definition? Echogenicity, in short, is the propensity to reflect ultrasound waves. The more echogenic a structure is, the stronger will be the returning echo. Practically speaking, the image will appear white or slightly lighter gray, a shade of gray. When a structure is termed hyperechoic, it means that the echo has higher amplitude relative to the surrounding structures. The appearance will be white, and examples that we're talking about that are hyperechoic structures are diaphragm, pericardium, the pleura, and bones. This next slide is an image of an ultrasound scan of a hypodermic needle within the surface of a patient's forearm. You can see here that there is a long linear structure with a hyperechoic nature to it. Compared to surrounding structures, the return echo amplitude definitely is greater than the surrounding soft tissue. As we point an arrow towards this hypodermic needle, you see that it is a very useful property of the metal because it's something that stands out within the ultrasound image. There are two more variations of echogenicity that I want to talk about. The next variation is hypoechoic intensity. This describes an echo of lower amplitude compared to the surrounding structures. It has a gray appearance. Typically, it describes soft tissues. Examples include kidneys, spleen, uterus, thrombus. And anechoic structures basically have minimal to nil echo amplitude, has a black appearance, describes unclotted blood, bile, urine, ascites, and pleural effusions. This next structure is an image of a patient's carotid region. On top, the vessel is the internal jugular vein on top of the carotid artery. Within the vein, the venous structure, you see there is a hypoechoic structure surrounded with anechoic fluid. So specifically, in terms of the hypoechoic structure, or let's start with the anechoic structure, we have blood, which surrounds the hypoechoic structure in the middle. So the arrow is pointing to the black region of the vein. Next, we're going to point out the hypoechoic thrombus, which is the medium amplitude structure, so residing within the internal jugular vein.